Welcome to another edition of Talk City Greensboro, produced by GTN, featuring interviews and events happening around town. It's an easy way to stay in the know while you're on the go. Subscribe to Talk City on iTunes, Stitcher, Google Play, or SoundCloud so you can keep up with what's going on in the Greensboro City government and beyond. I'm your host, Rodney Dawson, and with me as always, Rosemary Clown.
That's
Enough
me.
said.
Glad to be here. Well, housing, education, physical activity, stress, all of that in your life, plus so many other things really impact your health just as much, sometimes more so than actually the food that you're putting in your mouth. That's why Cone Health is leaving the hospital setting, getting out into the community, offering health screenings and services that include transportation, nutrition, employment, family services, mental health, much, much more. Dr. Olu Jegede is Vice President of Clinical Care and Health Equity. Hello and welcome.
Welcome to the
Thank
show.
you. Glad to be here.
We are glad to have you with us. So let's talk about this event, Building a Better You. What is that?
Yeah, thank you for the opportunity to share with your audience the Building a Better You event. This is our signature event that is part of our Catch 5 in 5. And Catch 5 in 5 stands for Collaborative Actions Toward Community Health. And the 5 in 5 is to increase life expectancy by 5 years over the next 5 years. And we chose this because of the disparities that we found in our city of Greensboro between zip codes, that we have 15-year life expectancy gap. And we think that is not acceptable. Again, Rosemary, like you said, what really determines outcome of health and leading to death is much more beyond just healthcare. So that is why we are doing this wellness event, to bring awareness to our community members, to be able to screen our community members of all chronic diseases that people don't usually are aware of. And when it sneaks in on them, it's most of the time too late. So we want to make sure that people get to know themselves and they have all the resources that they need, from housing to nutrition to food to even job search and all the social drivers of life expectancy.
Right.
With Dr. Jegede, I work in a home. My wife is a midwife for Cone Health. And so I'm hearing about screenings all the time. I'm also a caregiver for my mother. And I just recently did a study about that 5-year gap, in those zip codes 407 and 406.
Yes.
So when you talk about screenings, all kinds of things come to my mind. So what type of screenings will be offered, and is there a cost?
This is a free event for our community members. We have partnered, and that's why we call this a collaborative actions. We've partnered with almost 50, if not 60 community-based organizations and vendors that will be there. So we will have people from mental health screening, from housing insecurity screening, from food insecurity screening, for all the things, even a job search like unemployment. And that is beyond even the health screening that we're going to be doing for blood pressure, for blood sugar, for cholesterol. We're going to screen people, knowing that a lot of our community members with diabetes sometimes have high amputation rate. And once you have amputation, of course, your life expectancy is already cut short. So we're going to be screening people for what we call peripheral arterial disease, which means less blood supply to your extremes, like the legs. And if we screen people, we are connecting them to care. This is what is separating our health fair from others. So this is not just coming and knowing that you have blood pressure or blood sugar and then go home. No, we are going to connect you to a primary care doctor that you need right there on the spot.
That
And
is the
you
important
need,
part.
yeah,
Can do that next step.
exactly. Taken to the next step. So not just that you have blood pressure now, okay, bye. No, we are going to actually connect you to someone who will be your partner in managing this chronic disease along the way. And also, if you need a specialty care, they'll be able to refer you to specialty.
That's good to hear. So talk about what it is like to really leave the hospital walls, and why this is something Cone Health wants to do, to actually go into the community instead of asking people always to come to the hospital or even to some of the outpatient centers.
Yes, I'm glad you asked, Rosemary. Yeah. So one of the things that we do is to make sure we take care to our patient population. And if I can just give you one statistics, the people that live in one of our zip codes, almost 46,000 members, more than 21,000 of them have no doctor. So, and we know this because we've seen them whether in our emergency room or somewhere else, but not in a primary care office.
Mhm.
And so what we know is a lot of our people have issues with transportation.
Mhm.
So instead of staying here and say, come, we want to be able to be right there with them. We want to be able to be right there at the community to actually, sort out those social drivers that is preventing them from accessing care. We
Mhm.
know that care is available or healthcare is available does not mean it's accessible. So we want to give everyone a fair and just opportunity. So when we get there, then there is no excuse, right? You can walk up to us. There is no appointment needed. Everyone is there waiting to give you a chance to live as long as possible.
Oh, yeah, approachable. There'll be big smiles on their faces. Nobody's gonna, you know, wants to hurt you or gonna scowl at you.
Plus a lot of fun, I mean, for everyone, every family member, this is designed for everyone, children, adult, there will be fun, activities outside. Everyone is going to be served
Great
That's,
appropriately.
to hear.
Yeah.
that's great to hear. As I stated earlier, I got a spouse that works alongside you all, and so I hear about 5 and 5 all the time. And she often worked at the clinic over on East Greensboro at the Renaissance. And
Okay.
one of the challenges I kept hearing was they were doing events, but some people in the community didn't know about it, and they were constantly trying to, raise awareness in that area. But when you hear from the community, what are you hearing? Is this working? And what are you hearing about the events itself when you do the community
So
events?
yeah, we had one last year. That was our first one, the Building a Better You event. But the Catch 5 and 5 is actually in every areas that we go. This is the first time we are doing something like this. And the feedback we are hearing is actually encouraging that people are finding out what they did not know about themselves. People are finding out things that they did not know is available at the community level, like resources, like how do you find job? How do you apply for job? Housing insecurity, food and nutrition. They have teaching kitchen. Everyone is going to learn about how to cook healthy food, eat healthy diet. So we're hearing very encouraging feedback from our community members, and we have actually incorporated some of those into this year's event. So you're going to see this a much better event this year, and we're encouraging everyone to show up and come get your get screen and get the resources that you need.
Well, let's tell people where it is then. It is Building a Better You, a community health and wellness event, Saturday, June 29th, 11 to 3 at Corbett Sports Complex at North Carolina A&T. So a great
Aggie
central
Pride.
location. Yep, Aggie Pride. A great central location. You'll be able to find parking. There'll be a lot of folks, and I know there'll be lots of signs and excitement and fun around too. So don't go like begrudgingly. Go like ready to have fun and
Yeah,
something about yourself, and then go away and like be ready to take action with what you learn. That's the most important part, of course.
exactly. And mobile medicine will be there. So if you also need to see a provider, you can. So
Oh,
everything is
That's
available.
good.
that's
Yes.
great news. Well, thank you so much, Dr. Jegede. We really appreciate you spending some time with us today.
I
Yeah.
appreciate you.
Appreciate you coming on Talk City Greensboro.
Thank you, Rodney. I appreciate the opportunity.
All right. And our audience as well, thank you. And you can stay tuned in weekly by subscribing to Talk City Greensboro on iTunes, Stitcher, and Google Play. And don't forget, you can download Talk City from SoundCloud. That's it for this week. Thank you for tuning in to Talk City.
If you like what you hear, please share it with a friend. Don't forget to watch GTN. It's your official source for news and information about the city of Greensboro. GTN is available on Spectrum Channel 13.
AT&T, UVerse Channel 99, and Lumos 31.
GTN also streams live on Roku and the city's website at greensboro-nc.gov.